We are live. We are live. I'm Dr. Frita. Welcome to Dr. Frita's Medicine in the News, where we talk about all of the hot health topics in the news. We have quite an educational and entertainment show ready for you today. We're going to talk about Oprah. Y'all know that Oprah is hospitalized. Can you believe it? Yes. Now, she and her crew said that she has the stomach flu, but all of y'all out there chirping in the rumor mill say that it's due to Ozempic side effects. So we're going to break down Oprah's hospitalization, the likely cause, what I think, and most importantly, what you can do to prevent yourself from being hospitalized. And then we're going to talk about gas station Ozempic. That doesn't even sound right, does it? Well, yes, there's something called gas station Ozempic that even the youth are popping in pouches, and it's got quite a few side effects. So please, for everyone who's trying to do your do-it-yourself doctoring, be careful. We'll talk about the consequences of gas station Ozempic. And then sadly, we'll talk about a tragic death at a young age. Gucci Mane's former protege, Enchanting, young, beautiful, talented girl. She's now dead at the age of 26. And so we'll talk about some of the reported causes of death. We don't have the official reports as of yet, but we'll talk about some of the possibilities just so we can kind of figure out ways to keep ourselves and our loved ones safe in case some of the reported causes can be helpful. And here's something that's really breaking news. 2 Live Crew. I grew up on 2 Live Crew, but we just found out that brother Marquis is no longer alive. So we'll talk a little bit about that for as much news as we have. That's breaking news. All right. Make sure that you like this video as you come into the page and share it, because we will be discussing evidence-based medicine. We'll go over the hot health topics, and then most certainly we'll have our live Q&A. Stay with me. All right, let's go ahead and jump into these hot health topics. I'm going to talk to you about a whole lot today. I am Dr. Frita, but of course I won't be talking to you alone. I have my wonderful co-host and my practice manager for 12 years or more than 12 years, Miss Shador. Come on up and let's jump into these topics. Shador, how are you doing?
I'm pretty good. How are you?
Doing well, doing well. We have, a lot of tragic news to report. And unfortunately, that's the nature of the business when you're dealing in healthcare, as we deal with every day. But what I want to really do is try to turn all of the health news and even the tragic news into something that we can use to really promote health in our community. So let's go ahead and get started. Let's talk about Oprah Winfrey, Oprah and Gayle, Thelma and Louise. We know that Oprah was hospitalized and her bestie Gayle told all of her business. I'm talking about she told every last bit of her business. So according to Oprah, she was hospitalized with the stomach flu. She had nausea, vomiting, diarrhea, things coming out of both ends, to quote Gayle. But you have all of y'all out here in rumor mill saying that she had side effects from Ozempic. So here's what I want you to do. Put a 1 if you believe Oprah and her team that she actually had the stomach flu. Put a 2 if you're suspicious that her sickness and her hospitalization was due to Ozempic side effects. 1 if you believe Oprah. 2 if you think it's shady and it's side effects from Ozempic. All right, let's play that clip.
All right.
Everybody I've ever known that has access to my email has called me to say, "Are you all right?" Thanks.
She had some kind of stomach flu where stuff was coming out of both ends. I won't get too graphic.
Oprah Winfrey and Gayle King hitting back at health headlines after the CBS Mornings host shared this concerning update Tuesday.
But needless to say, she ended up in the hospital, dehydration, to get an IV. So it was a very serious thing.
No, I never said you were hospitalized. I did say that you had a stomach something was coming out of both sides, which it was. You were dehydrated.
Yeah. Like dry mouth, and I couldn't keep enough water down to get hydrated. So I went to the emergency room for that.
This friend has always wanted more from me than I ever wanted for myself.
Oprah's bestie wanting to explain her absence with those initial comments, including that TMI both ends detail.
She will be okay. She will be okay. I hope she's not mad at me for sharing that detail.
Were you offended because I said what I said about what happened and how you're recovering? I really didn't think it was a big deal, or that it would be something that would be upsetting to you. Otherwise, I never would have said it.
Yeah, I know you wouldn't have done that. No, I thought what you were trying to do was to explain why I wasn't there and doing that in a definitive way.
And for me, it really is true that when I discover
Okay.
something that I love.
All right. So that's the story. Oprah was hospitalized, and there you have it. Shador, who was the first person in the chat today?
Yes, ma'am. Our first person today, Miss V.E. Hall.
Hi, welcome back, Miss V.E. Hall. Good to see you. All right. And did anyone weigh in on a 1, if you believe Oprah, that she actually had the stomach flu, or 2, if you are suspicious, like some of the people in the rumor mill, that her sickness was due to side effects of Ozempic? Any 1s or any 2s thus far?
Of course, you know, they're always weighing in. So
Now let me hear what they have to say here.
Sonya gave us a 2.
Oh, you don't believe Oprah? All right, Sonya. Hi.
Randy gave a 1. Does believe
Oh,
Oprah.
hi, Mr. Randy. Okay,
A
he
lot of
believes
people not
Oprah.
believing Oprah here.
Now they about to
Kim?
make me mad. Who else?
Kim.
Hi, Kim. Kim, what? She doesn't believe Oprah?
Mm-mm.
Oprah or Gayle? Oh my gosh. All right, Kim. Who else?
P. Davis.
P. Davis. I know P. Davis believes Oprah. No?
No. All
A
these are
2?
2s. There's a lot of more 2s than 1s here, definitely.
Oh my goodness. Oh my goodness. Okay. Well, let's just talk about it. And I'll tell y'all what I believe. Okay. Now, of course, I'm not Oprah Winfrey's physician. I don't know her. I don't know any of the ins and outs of it, but I'll give you my opinion on if I, 1, believe Oprah, or 2, if I think she's being shady and it's the Ozempic. We'll talk about it. So first, let's talk about what she says that she has. So Gayle revealed that Oprah was supposed to be on that show, the CBS Morning, to talk about her book club. That's something she apparently never misses. So when she missed it, it was a really big deal. And Gayle just really wanted us to know that in order for her to miss that show, for Oprah to miss it, she had to be pretty much deathly ill. And she had vomiting and diarrhea, and apparently was not able to keep up with her drinking and got very dehydrated. So according to Oprah, she was diagnosed with the stomach flu. And the other name for stomach flu is gastroenteritis. Okay, gastroenteritis. And as I explained this, I want y'all in the chat to tell me, other than stomach flu and other than Ozempic side effects, what are some other things that you think can cause vomiting and diarrhea? You just throw those things in the chat, and we'll talk about those when we finish talking about this. And make sure that you like this video as you come in, and please go ahead and share. It lets YouTube know that we're here and that we're giving helpful, evidence-based information. Like and share this video, please. Okay. So it's a gastroenteritis. And what a gastroenteritis or stomach flu means is that literally there's an infection in the intestines, and it can cause watery diarrhea. It can cause vomiting, nausea, fever in some cases. And by definition, a fever is when your temperature is 100.4 degrees Fahrenheit. So it can cause fever and fatigue and all those things. And these are the symptoms that Oprah Winfrey described. So a lot of people have dealt with the stomach flu at some point in their lives. And stomach flu is not the same as the typical influenza that we see. Be sure that you watch my video here on the Dr. Frita YouTube channel. I'm very proud because we have over 725,000 subscribers. We've got a lot of good evidence-based medicine, but I have a video fully explaining influenza, the flu. That's different from the stomach flu. So with the stomach flu, it doesn't affect the respiratory system, just the GI system. Okay. But when people get the stomach flu, you know, a lot of times, usually, especially in healthy people, you get over it on your own. Okay. You're down and out, you're vomiting, you have diarrhea, you feel like you got run over by a Mack truck. And then within a matter of hours or a day or so, you're better. It's different though when you're immunocompromised. So if you're immunocompromised, meaning you're on chemotherapy or something like that, or if you are very young, like an infant, or if you are elderly, then this stomach flu that Oprah describes that she had can actually be life-threatening, which in Oprah's case, she had to go to the doctor because she was very dehydrated. And people can lose their lives from the stomach flu. Okay. It literally can be deadly. Now, for all of you naysayers, all of you twos, I see you. You're saying you're not so sure. You think it could be side effects from Ozempic. Okay, well, to be fair, Oprah, who was the face of Weight Watchers, did recently share that she is also using a weight loss drug. To my knowledge, she didn't specify which drug. Many people have assumed it's one of the shots like Ozempic or Mounjaro or Wegovy or Zepbound. At any rate, these folks, these folks who don't believe Oprah think that she could be having Ozempic side effects. Okay, well, let's talk about some of the Ozempic side effects. Can you get vomiting and all of that and dehydration from Ozempic? Is it possible? Yeah, it's possible. With Ozempic, that GLP-1 agonist, you can get something called gastroparesis. That's different from the stomach flu. The stomach flu, the other name is gastroenteritis. Ozempic, the other name is gastroparesis. And with gastroparesis, the stomach motility slows down and you can get nausea, you can get vomiting, you can get abdominal cramps. Okay. So if you can get the same symptoms from either one, then how can we know? Not that it's our business, but how can we know if Oprah's telling the truth about having the stomach flu versus, are these side effects of Ozempic? Well, I'll tell you, because y'all want to know if I'm a 1 or a 2.
Mm-hmm.
I'm a 1. I'm a 1. I believe Oprah, and let me tell you why. Oprah, in that interview she was having the discussion with Gayle, shared that at least 5 other people in her household also had stomach flu symptoms at the same time. The stomach flu or gastroenteritis is very contagious. Ozempic side effects are not. And so, assuming she's telling the truth, which I don't see why she would come on here and say 5 people are sick. I just don't think she would do that. If 5 people were sick, that means they likely had a contagious disease. The stomach flu is contagious. Ozempic side effects are not. So that's why I believe her that she had the stomach flu. And so just a few things to note: ways to prevent getting the stomach flu: frequent and thorough hand washing. Make sure you avoid contact with someone who actually has the stomach flu. Avoid things that they touch. If you're taking care of someone, don't touch their clothing directly. Don't do their laundry directly. If they touch, doorknobs, clean them off before you touch them, because it is very contagious, the stomach flu. And these are ways to help yourself to prevent it. And when you need to go to the doctor, if you've been vomiting for over 24 hours, or if you've had vomiting and or diarrhea for more than a day or two, you need to go to the doctor. If you have high fever, like 102, 103, certainly degrees Fahrenheit, you need to go to the doctor. And if you have bloody diarrhea, you need to go to the doctor. So it looks like Oprah is on the mend, that she's doing much better, but I just want to kind of talk about her illness so that, we educate ourselves on stomach flu and on one of the side effects of Ozempic. But I personally believe Oprah. Again, I'm not her doctor. Shador, did any one of our naysayers throw out any other possibilities? You know what? I love everybody in our chat. This is just too much. But did anyone else say anything about other things that can cause nausea, vomiting, diarrhea?
Oh yeah, of course. They weigh in. So Miss
right.
Yvonne says
Hi,
food
Miss
poisoning. That's
Absolutely.
food poisoning.
Food poisoning. And really, so yes, so food poisoning can be a form of gastroenteritis. And when you're talking about food poisoning, you're probably talking about like a bacterial food poisoning. So something like salmonella or shigella or campylobacter or even that E. coli. Okay, so absolutely, food poisoning can do it.
T chosen one
Hi, T chosen one
says COVID, maybe question mark.
Yes, anyone who had COVID or knew, if you didn't have it, somebody who had it. And yes, and even though COVID very largely would attack the respiratory system, it could cause you to be fatigued. It can cause just about any symptom. So surely that's something that could possibly cause it. So good.
Miss Bernadine, hi. Not eating enough.
That's interesting. Not eating enough. Now, not eating enough can certainly make you fatigued, can make you tired. But if you're not eating anything, then you likely don't have very much to put out. So that's not necessarily in and of itself a trigger, but you can have illnesses that cause anorexia or cause you not to eat enough. And those same illnesses could potentially cause vomiting. All right. We'll do maybe one. Oh, no.
From Coco Mango. Pregnancy. Coco Mango.
You know what, Coco Mango? What you got, Coco Mango?
Pregnancy.
Word up. Yes. Pregnancy could definitely cause nausea and vomiting. 100%. I don't think Oprah's pregnant. But yes, pregnancy can cause nausea and vomiting for different reasons. Yeah. And early on, first trimester, when your body's hormones are just like, say what? You can get vomiting. And then even later in the pregnancy, when that big old baby in your womb is pushing up against your stomach, giving you very little room. And also when the pregnancy is causing the esophageal sphincter, which is that separation between that tube that leads to your stomach and the stomach, that there's a little sphincter, a little closing that keeps stomach acid normally from going up into the esophagus. When you're pregnant, that thing can relax and you get bad reflux, and that can cause nausea and vomiting. Yeah, that's a good one to end on, I think, Shador. All right. So wishing Oprah well, of course. And yes, full disclosure, full transparency. I am an Oprah fan. Yay. Hashtag Oprah and Gayle. Okay. So that's that on Oprah Winfrey. Now, Shador, speaking of Ozempic side effects, can we talk about the gas station? And maybe you can explain to me, Shador, why do people want to get their medical care from the gas station?
I have no idea.
Anyone? All right.
Unbeknownst to me.
Okay. Well, there's something called a gas station Ozempic. Put a 3 in the chat if you've heard of gas station Ozempic. And I'm not going to even ask y'all if y'all think it's a good idea. I refuse. All right. But there's something called gas station Ozempic, and even young kids are getting a hold to it because it apparently suppresses the appetite. But you already know that I'm not going to like it. So let's play this clip and let's talk about how to look out to see if you have loved ones doing it, especially your kids. Gas station Ozempic.
You may have heard of Zyn lately. It's an increasingly popular nicotine pouch, and it has enthusiastic following. Zinfluencers are getting online to sing its praises all across TikTok and Instagram. You can see users popping these little white pouches between their gums and cheek. The pouch does not contain tobacco, but it does contain nicotine, flavorings, and plant-based fibers. Users often talk about getting a rush from the effects. Senator Chuck Schumer had this to say about Zyn at a press conference a couple of weeks ago.
Pouch packed with problems, high levels of nicotine. So today I'm delivering a warning to parents because these nicotine pouches seem to lock their sights on young kids, teenagers, and even lower, and then use the social media to hook them.
With flavors like cinnamon, citrus, even coffee, no surprise that the nicotine pouch market has exploded into a multi-billion-dollar industry, but the negative effects on health are growing even faster. Dr. Nady Kumar is on call to break it all down for us. Good morning to you. Good to see you.
Good morning.
What do you think in regard to safety? Is it safe? Are they safer than cigarettes? I mean, what's your thought on this?
Well, we really don't know. And I mean, they are gaining a lot of popularity, first because they're marketed as being safe, but we really have no long-term data. These products are also marketed as being products that can help you quit smoking. Again, we have no data to substantiate that as well. And finally, probably what's most concerning is we are hooking a whole new generation of young people onto nicotine. The strategies.
Oh my goodness. I cannot even believe this. So do we have any 3s? Anyone heard of this gas station Ozempic?
I do not see any 3s.
Okay. And I'll tell you, it's still scary, Shador, because even if folks in our chat have not heard of it, the teenagers have heard of it, okay? With these different flavors. I think one flavor is even called Chill. They have like these really cool names, and it's largely marketed to kids. And so these Zen packs, like when I think about Zen, I think about peace, love, peace, and hair grease. I think about something that's good, something that's positive. But these Zen nicotine patches are anything but. Shador, they're loaded with nicotine. And here's the thing. They're calling it gas station Ozempic, but we know, because we talked about it on this show, that the actual Ozempic, the GLP-1 agonist, the shots that were originally for diabetes and now can also be used for weight loss, the Ozempic, the Mounjaro, those are over $1,000 a month, $1,300 a month, $1,400 a month. These Zen pouches, these gas station nicotine pouches, are only $5. So you know good and well you don't get something for nothing. But here's what's happening, Shador. These pouches are allowed to be sold at gas stations, but they're not FDA approved. And so we know that they're loaded down with nicotine, but we don't know what else is in them because they're not regulated. So here's the thing with nicotine. Nicotine can give you a certain, like a high or euphoria. And so a lot of people who have long road trips or need to stay up or need to study or focus or be out partying, they'll pop the Zen pouches, the nicotine pouches, to stay awake. Well, these patches tend to have a side effect where they can also suppress the appetite. So that's why they're calling it gas station Ozempic. People think that it's a quick fix, that you can lose weight. Hey, no problems. But, you know, very seldom do you have something for nothing. There's always side effects. And specifically with nicotine, you can have an increase in blood pressure, Okay. And you know, I have a problem with that. Y'all know I'm a board certified high blood pressure specialist, kidney specialist. No bueno. That high blood pressure is a leading cause of strokes, heart attacks, kidney disease. It can cause a fast heart rate. So you can imagine if you're dealing with someone who already has heart disease, or if they have atrial fibrillation and irregular heart rate, this nicotine could send them over. And then specifically for kids, listen, for kids, nicotine can have effects on these developing brains. Okay, it can cause cognition problems, memory problems, impulse control problems, Lord help us, all kinds of issues. And very importantly, these Zen pouches, this gas station Ozempic, can lead to addiction. Yes, it can trigger the addiction pathway in the brain. Okay, so it can stimulate the dopamine pathway, the serotonin pathway, where one nicotine patch may be enough, and then you may need 2, you may need 3, always chasing that high. Make sure that you check out right here on this Dr. Frita YouTube channel, my video on addiction. I go into details on how the addiction pathway works. And I do this in my Wendy Williams series. There's a playlist you can check out. And so if you go to the Wendy Williams playlist, like what's happening with Wendy Williams Health, go to addiction. It will be eye-opening. It'll make you talk to your kids, your loved ones. It might even make you look at yourself as far as addiction. All right. So I'm glad that y'all now know about gas station Ozempic. If you hadn't heard about it, if you don't know, now you know. So I'm very happy about that. All right. So, all right, as we go on to our next topic, please, yes, be sure that you like this video, share this video, subscribe to my channel. And while we're talking about these health topics, I want you to remember that there's other sources that I have for you. Yes, I have the all of the wonderful videos on my YouTube channel, but then I actually have a PDF, and I'm offering it to you as a freebie. Who doesn't love a freebie? You can click the link in our description to get it. I have a guide on 10 healthy habits for a better you and a better life, where I go through the habits that I go through on my day-to-day life, just to kind of keep yourself having your healthiest, happiest life. So make sure you go ahead and download that PDF. It's free, but the value it will give you is priceless. All right, Shador.
Yes, ma'am.
Let's go on to our next topic. And as we get ready to go into this next topic, we'll hit maybe 1 or 2 topics, and then we'll get to my favorite part, which is the live Q&A. So go ahead and be thinking about your questions. And if you want to try to come up on stage, just put an orange heart emoji by your question, and we'll see if we can get you up on stage. If not, you can ask about any of the topics we've talked about, such as Ozempic or any of the weight loss shots. You can ask about gastroenteritis, stomach flu. You can ask about the gas station Ozempic. We can talk about that. We can talk about nicotine some more. And of course, you can always ask me about kidney disease and high blood pressure. And I've got so much information on kidney disease and high blood pressure I want you to check out. But if you have any questions, remember that what I give is information. It does not replace the advice of your physician. But we'll move on to the next topic, and then soon we'll move on to the live Q&A. So this is another one of those tragic topics, Shador. Another one of those tragic topics. I know y'all have heard of Gucci Mane. So he has an ex-protege named Enchanting, and she really was a beautiful young lady. She had a lovely voice, and she sang, how she describes it, a mix of trap music and the blues. Okay, she was kind of an old soul. And I don't know, one of her, I think, mixtapes, which really marked her debut, was called Love and Drugs, which I hope that wasn't foreshadowing, because she was pronounced to be unalive. She's no longer alive. She lost her life at the age of 26. Now, there's been no official report as to why she lost her life, but there have been some remorse and some reports, some unsubstantiated reports, so alleged reports, that drug overdose is suspected. Again, the official cause of death is not repeated, so all of that is alleged. I'm not saying that that is why she died, but what I do want to do is to go ahead and, just because it's been brought up, I want to talk about drug overdose in general. Again, I do not know Enchanting's cause of death, and my condolences go out to her family and to her loved ones. This beautiful, beautiful life. So we'll go ahead, we'll listen to the clip, and then we'll just talk in general about drug overdose.
The hip-hop community is mourning a tragic loss. Enchanting, a rising rapper formerly signed to Gucci Mane's 1017 Records, has died. Her close friend and collaborator, Lil CJ Casino, confirmed on social media. Casino writes in a June 11th Instagram post, "They pulled the plug, bro. This so up. I just knew you was finna pull through. you gone forever. Adding, they don't know all hours you spent at the casino studio, sleeping there, making music, putting this shit together, and you went way further than us. I always told you how proud I was of you. A cause of death was not disclosed, but news of the No Love rapper's passing comes a few days after it was reported by multiple outlets that she had been placed on life support. Alongside the message, Casino also shared a photo of Enchanting, whose real name is Channing Nicole Larry, sitting in a recording booth. The rapper was raised primarily between Fort Worth, Texas and Atlanta, Georgia. Enchanting got her start in music at age 18 and began pursuing a career in hip-hop following her high school graduation. In 2020, she signed to Gucci Mane's 1017 Records and appeared on 3 compilation albums before parting ways with the label. Enchanting released 2 full-length albums, 2022's No Love and 2023's Love Scarred, No Love. The rapper shares in her artist profile on the 1017 Records website, quote, "Staying in the studio and constantly recording, it helps me find the style I can be good at. It's like trap and blues." But music wasn't just a form of self-expression for Chanting. As she notes, quote, "Other people can relate to the things I say. I might help somebody through any situation. They can listen to me and find peace." Following news of her death, fellow artists shared heartfelt tributes to the rapper.
Okay. Yeah. So anytime we have someone who's super young who passes away, it's very heavy. But let's see. I want, if any of y'all have any questions, just in general, again, I do not know why she passed. Okay. I do not know. I know there have been rumors, but I do want to talk about overdose just because that's one of the rumors, not as to put a damper on the life that she lived, but just for us to educate ourselves, because the fact of the matter is that drug overdose is real. The opioid crisis has been on the rise, and it's something that's affecting all communities. Okay. Suburban communities, rural communities, rap communities. We have people who, different rap songs, admittedly, that I sit up here bopping my head to, but if you stop and listen to the songs, Percocet, Molly Percocet, just, it's just infused in our culture, yet it's very serious and it can cause one to lose his or her life. So the opioid crisis, I want to touch on that one, Shador. And again, if anyone has any questions, you can go ahead and put that in the chat if you have any questions about drug overdose, and then we'll move to our live Q&A. But the big one, Shador, has been fentanyl. And I know you've heard us talk about that in the different rooms and the different panels we've done, but fentanyl is a synthetic opioid, okay? And, the opioids, the narcotics, can give you a high, right? They give you a euphoria, a feeling of just feeling no pain, feeling joy. And they definitely attack that addictive pathway, that dopamine, that serotonin we talked about that you can find in my YouTube video on addiction. So the thing about fentanyl is that it's synthetic and it is very, very strong. It's potent. It's 50 times stronger than heroin, 50, and up to 100 times stronger than morphine. So for any of you who've ever been in the hospital, or you ever had some morphine is a heck of a drug, in the words of Rick James. I'm Rick James. And so for the fentanyl to be stronger than heroin and stronger than morphine, that's something powerful. And of course, it's very addictive. Now, we do use fentanyl in hospitals, okay, in the form of patches, in the form of shots. And like, as a physician, if I want to give someone fentanyl, there has to be 2 people, because even doctors have gotten caught up, okay, and nurses in some of the opioid overdose. At any rate, it's a very careful system to make sure that even healthcare workers don't have just carte blanche access to the drugs. At any rate, there's one way when it's regulated in the hospital, but when you're dealing with fentanyl as a street drug, of course, there's no regulation. And so it doesn't take much fentanyl for one to overdose. Do you know how much it takes? 2 milligrams. So that's the equivalent to about 10 grains of salt. That's nothing, right, Shador? 10 grains of salt. Okay. An overdose of fentanyl, you could put it on the tip of a pencil. And so you can imagine how a lot of people overdose, especially if you've been in that life where you've been doing drugs, and maybe you have drugs, I don't know, fentanyl. People are lacing marijuana with fentanyl. We know that marijuana has really gotten to be very common in use. There's something called rainbow fentanyl, where it actually looks like Skittles. People are doing that. And so just to be warned, we haven't talked about, I know it has not been the headlines in a while, but fentanyl overdose is real. Folks are partying with people and they think they're down with them. Hey, we're all here together, but you have folks you can't trust, okay? And they may lace your stuff. They may lace your drugs, but there is something you can do about it. You can get fentanyl test strips, okay? So talk to your pharmacy or your local health department about that, where literally, which of course I don't encourage you to do any type of a drug, but just being real, people do indulge. If you are going to indulge, and I'm talking about even in marijuana or pills like ecstasy, things that you don't necessarily think even might have fentanyl in them. There have been some ADHD drugs, some Adderall that's been laced with fentanyl, but you get yourself a fentanyl test strip and they give you instructions. You mix a certain amount of water, you dip it, and it'll let you know if there's fentanyl in there so you can save a life. Also, there's Narcan or naloxone, which is an antidote, okay? It combats opioid overdose. So if you are someone who partakes in drugs of any kind, get yourself some Narcan, consult with your physician. Again, talk to the health department and things of that nature, call your pharmacist. There are things that you can do. Have the Narcan, have the fentanyl test strips. It's real. And if you get invited to some of these parties we've been hearing about, because you know how Diddy has been in the news, and he's not the only one. Y'all know there's lots of drugs at parties, and a lot of folks who are influenced by young Instagram models, or I'm here in Atlanta, people who want to be with the in crowd or go to this party, happy they're at celebrity parties. You might go and you might feel pressured, okay, to do certain drugs. They might pop you or send you a pill. Please don't do it. You don't know what's in that stuff. And for goodness sake, don't use pink cocaine. What in the world is pink cocaine? I really just started hearing about that when all these different indictments started coming out, like against Diddy, alleged, but some folks have accused pink cocaine being something that's at his parties and other parties. So pink cocaine is not strict cocaine. It's ketamine, okay? And it can be mixed with one or two other drugs like ecstasy, like cocaine, like methamphetamines, okay? It can be a mixture. Make sure you go to my YouTube channel right here. You're already there, Dr. Frita, and check out my video on ecstasy, also called Molly. What is Molly? The truth about Molly. All right. Do we have any questions, Shador, specifically about what we're talking about drug overdose?
Not a question, but Monica did make a comment.
Hi, Monica.
She said she had fentanyl in recovery after knee surgery. It kills the pain right away. I can understand how people with pain issues get hooked.
Absolutely. And I'm glad you brought that up, Monica, because I think that there are a lot of folks who are really judgmental and they think, oh, it can never happen to me. It can never happen to me. I know quite a few people who have been addicted. It's not, you're not around the corner, smoking fentanyl out of a crack pipe. Like there's, I'm doing, you're out like one of these stereotypical characters, or like Halle Berry's character on Jungle Fever, was it? Or Samuel Jackson saying, because I'm a crackhead. That's not what it is. Pain is no joke. So you mentioned your knee surgery. And then, of course, people have, chronic low back pain, or I have rheumatoid arthritis patients who have pain all over their bodies, or lupus. Nobody wants to be in pain. Pain, not only does it hurt, it can lead you to a depression. So you can be in physical pain and mental pain. So I'm glad you brought up that human side of it. It is understandable why people could start off something just for pain, but then need more, that addiction pathway that I talk about in that YouTube video. So yeah, so it's a real thing. And so then you can also guess it wouldn't be far-fetched if you're in a community or you're hanging around, a certain group of people where doing drugs is accepted, how addiction can occur and accidental overdose can occur. Or even if you get into that dark place, some people can actually try to hurt themselves on purpose. If you or a loved one is thinking about hurting themselves, please text or call 988. That's the lifeline, and you can have someone to help talk you down from a crisis. Please, whatever you think it is, don't hurt yourself. Text or call 988. All right. Thank you for that, Monica. I appreciate that. Yeah. All right. And then, we had that news, and this literally just broke, so I don't have much information on it.
There's new information on TMZ.
Oh, do you have that? Can you read that or play that? And this, we're talking
so
about
there's not a clip. I'll bring up.
Okay. Breaking news, y'all, and not good news.
But they did report that he passed on June the 3rd.
And you're talking about Brother Marquis.
Brother Marquis
was in 2 Live Crew. Okay, Mark Ross, but I just know him as Brother Marquis, 2 Live Crew. Mm-hmm. All right. What's
from a massive heart attack is what they're confirming.
And are they saying there when? Because I believe it was just today.
No, they're saying June the 3rd.
Oh, okay.
Is reporting.
Okay, so we're just finding out about it today.
Mm-hmm.
Okay. Oh, I can't stand that. All right. So depending on the age of the folks in this chat, you may or may not know Brother Marquis, but I do. Okay, because he was a member of 2 Live Crew, just like Luke Uncle Luke Skywalker. And here's the deal. This group was so controversial. And of course, they had good beats. They had rap music. They had the explicit versions. So, mama never would let me buy it. So I would have to sneak at my friend's house or listen to a mixtape. Yes, cassette tape. Do y'all still know what cassette tapes are? But I would listen to my 2 Live Crew cassette tapes. They had all kind of cursing. Ooh, Clutch the Pearls. But that music, I used to like that music. I'm not going to even pretend like I didn't. And then the other thing about 2 Live Crew, where they really pushed the limit, is that they actually got political. And they had this one song, Banned in the USA. Banned in the USA. And it was a play on the more popular mainstream song, Born in the USA. But they were talking about censorship. Okay, they were talking about censorship, which of course was a real thing. And yeah, their music was nasty. It was real nasty. But when does it cross, interfering with their right of freedom of speech when you're actually banning their music, and how much of it was a microaggression or people who didn't like their music culturally? The other thing with 2 Live Crew and why they were really cutting edge. Yeah, I know that music. Yeah, it had bad words, but there was something, there were levels to it. They had these magazine covers and the women who were on the covers. Oh my goodness. We talk about now how everyone is airbrushed, and you have different people with eating disorders trying to get to unrealistically thin body types. Well, back then, the women on their covers were shaped like brick houses. If they had cellulite, oh well. If they had stretch marks, oh well. They just had very much an appreciation for a woman's body, and specifically, they mostly had Black women's bodies. There was a lot of pride in that. So they were really controversial, really history making. So rest in peace, brother Marquis. So it was a heart attack. So yeah, so TMZ broke that. And of course, we do know that heart disease is the number 1 cause of death in the United States. Heart disease is the number 1 cause of death. There's all kinds of risk factors. Of course, being an older person, being a cigarette smoker is a risk factor for having a heart attack. Being someone who is at an unhealthy weight, having high cholesterol. Make sure you check out my YouTube videos. I have a plethora of videos on heart disease symptoms, heart attack warning signs. Also, I have a video right here on this YouTube channel, how to unclog your arteries naturally. So make sure y'all take care of yourself. Rest in peace to brother Marquis and to Enchanting, an appreciation to what they've donated to the culture. And I really pray that their families do well. Doggone it. That takes me back. 2 Live Crew. All right, Shador. Now, one thing I do want y'all to check out as we get ready to slide into this Q&A section. You notice that we talk about a whole lot on this channel. We talk about all of the hot health headlines, and I really have to bite my tongue to keep from going on and on and on and on, because as those of you who've been following me know, that I just love learning, and more than learning, beyond loving learning, I love sharing what I've learned, which is why I just sit up here and rub my mouth on this channel. And yes, I'm a board certified nephrologist, meaning I'm a specialist in kidney disease and high blood pressure. I have also received board certifications in internal medicine and pediatrics, which I got after I completed my dual residency at Georgetown. And most recently, I received my board certification in obesity medicine from the American Board of Obesity Medicine. So I like to talk a lot about a lot and share information so that we can all live our healthiest, happiest lives. As we get ready to move into this question and answer session, if you actually have a question that requires, some in-depth knowledge, or you want to get a chance to talk to me one-on-one, make sure you click the link in the description, because I do offer a telehealth concierge service. You can book a nice amount of time with me. I can get your history in detail, find out what I need to know about you, find out what your labs are, find out what your symptoms are, and we can talk about it in a one-on-one manner. And then I can give you some information based in more detail. Also, if you just want to run something by me for a second opinion, I can talk about just about any topic, and I will give you my honest, professional insight based on what you share. And I am honest, okay, when I give you a second opinion and give you some information. So make sure you check out that concierge service if you have a more personalized question that you want to ask. All right. Well, make sure you go ahead, please, and remember to hit that like button while you're in here. Like, subscribe, share this video, And let's go ahead and let's get into some questions. So you can ask questions about any of the topics we talked about so far, like Oprah, the stomach flu, Ozempic, gas station Ozempic, drug overdoses, and even heart attacks. Now that we understand that Brother Marquis, that was his cause of death. Do we have any questions thus far?
Yes, we do have a couple of questions thus far.
Okay. All right. And I won't be able to get to all of the questions because we're going to wrap this up at, by the time we get to the hour. And so we'll just have to go ahead and Shador will figure out, and we'll kind of try to pick and choose some of the questions. So hopefully we can get your question in. Hopefully we see your question.
All right. So I'm going to start with Sheree.
Hi, Sheree.
Can one heavy sodium meal, approximately 4,320 milligrams, in a restaurant cause a problem in CKD or lower EGFR?
Okay. So can one heavy sodium meal, and the meal you mentioned, Sheree, thank you for that question, was over 4,000 milligrams. So that is a heavy sodium meal because we know that according to the American Heart Association, the daily recommendation for salt or sodium is no more than 1,500 milligrams of sodium. So that's quite the heavy sodium load. But the way that you asked the question, Sheree, is can one meal cause a problem with CKD and EGFR? Well, when you're dealing with CKD, chronic kidney disease, the key word is chronic. It's something that typically happens over time. And so one-off of a meal is likely not going to cause a big problem. Yes, having one high sodium meal can send your blood pressure up. Yes, having one high sodium meal can cause you to have some swelling in your ankles and feet. But it's more the long term of the overuse of sodium that can lead to high blood pressure, which is the number 2 cause of kidney failure. And that can certainly cause an issue. And having that high blood pressure can cause your EGFR, your estimated glomerular filtration rate, to lower. Make sure you check out my YouTube video, Sheree, right here on this YouTube channel, Dr. Frita YouTube channel, on CKD stages, where I go into more detail.
All right. Thank you for that explanation. Ms. Kim asked Dr. Frita.
Hi, Ms. Kim.
Do you accept Medicare and Medicaid?
Oh, yes, that's easy. I accept Medicare and Medicaid. And if you go to my website, dr.frita.com, DRFRIT, as in take care of yourself, a.com, you can get more information on how to contact us. And when you reach out to the office, it'll be very familiar because Shador, my co-host, is also my practice manager. And so she'll take it from there. But yes, I take Medicare and Medicaid.
All right. And Georgia Medicaid specifically is
yes.
Yeah. All right. This is from Coco.
Hi, Coco.
Can berberine be used to control blood sugar, and is it safe for children?
Oh, wow. Okay, so that's a really good question. So berberine, and I actually, if you go to right here on my YouTube channel, once you're finished with this live, I want you to go to my playlist where I have my television appearances, okay? Because I do a lot of medicine in the media, a lot of national news shows, and berberine is something that I've done a national news show about. So please go check out that video. But basically, the data on berberine is limited. Now, there have been some studies, specifically in mice, that show that berberine can help with blood sugar to a degree, and to a very small degree in these studies, it can help with weight loss. I know that some people were calling berberine nature's Ozempic, but there's no comparison. When you're dealing with Ozempic and Mounjaro, you're talking about people losing 50% of their body weight, 22% of their body weight. But with berberine, depending on what study you review, it may be something like less than 1%. So consult with your doctor, because I do know some doctors who use berberine as a supplement in conjunction with other medications, but by no means is berberine going to be a replacement for some of our classically more well-studied traditional medicines for lowering blood sugar and for weight loss. And there are some potential side effects, which I get into in that television clip of berberine. I would not trust giving anything to my child unless I consulted with the physician first. So if you're at home kind of trying to do some natural remedies, please do not give berberine to your child unless you have consulted with your child's pediatrician. Thank you for that question.
Yes, thank you, Coco. Next question comes from Ms. Shailene.
Hi, Ms. Shailene.
If an individual is on Ozempic, should there be extreme pain on lower right abdomen, or does it possibly contribute to something else?
Short answer, no. Short answer, no. There should not be extreme pain in the lower right abdomen. And there's so many things that can cause pain, but let's just talk about Ozempic in general. So we know that it's one of the GLP-1 agonists, one of the drugs that was originally meant and studied in diabetes. Okay, very successful in helping people to maintain normal blood sugar levels and treating diabetes. But as a side benefit, they found that it helped with weight loss, right? And so that's why Ozempic was originally for diabetes. And now it's been FDA approved in the prescription Wegovy for weight loss. Okay, so it's not without side effects. So you have side effects of Ozempic that can include the abdominal pain, cramping, nausea, and vomiting if someone gets gastroparesis, as we discussed earlier. That pain is typically not in the right lower quadrant, but we'll come back and I'll talk to you about right lower quadrant pain. Some people who are on the Ozempic can get kidney stones, but typically it's because not only does the Ozempic suppress your appetite for carbohydrates and for sweets and for excess food, it can also, in some cases, suppress your thirst. And so if you're very dehydrated, that can increase your risk for kidney stones. That's why it's important if you're taking Ozempic to do it under the supervision of a physician. Some people with Ozempic can get gallbladder disease. Okay. That's oftentimes from losing the weight too fast. That's why you want to talk to your doctor about the minimum calories you should take in. Please make sure you watch my YouTube video on Ozempic. Okay. Is it the holy grail or is it a risky choice? Now, as far as that right lower quadrant pain, if you're someone who's has that gastroparesis and there's a slowing down of the motility of your stomach, then yes, it is possible that you can get a right lower quadrant pain, but this is not normal. Okay, this is not normal. So please consult with your physician, or if this pain is excruciating, if you're having nausea, if you're having vomiting, difficulty with bowel movements, call 911. But when you think about the right lower quadrant, some of the typical organs that are there, of course, your intestines are there, but also your appendix. So you want to make sure you're not having appendicitis. And so if you, like right now, if you try to get up and jump up and down, or if someone pushes you on your belly and it's excruciating, then there's a chance that you can have an inflamed appendix. In that case, you definitely want to activate call your doctor. It's after hours now. If you're having that kind of pain, you definitely want to, very strongly consider going to the ER or calling 911. And other things that in the right lower quadrant pain, if you are a female, born female, it can be an issue with ovaries. It can be, like a torsed ovary that can be in that, pain can radiate in that side of the stomach. You could have endometriosis. You can have all kinds of issues, even an ectopic pregnancy. Okay. But short answer, which I gave a long one, is it's not normal if this is happening with Ozempic. Consult with your physician.
All right, thank you.
All right, y'all, make sure you're liking this video. We're giving y'all some good old evidence-based medicine. Like it, and very importantly, go ahead and share it. Just hit that copy link and send it to some folks in your contacts and tell them to come on and catch the last few minutes of our live. They can always catch it in the replay. All right, we have any more questions, Shador?
We do. I have a question from Private Confidential.
Oh. Now, Private Confidential, this live is public. So, all right, let's go.
Why can't COVID be cured with antibiotics or steroids, etc.?
Oh, that's a very good question. Why can't COVID be cured with antibiotics, steroids, etc.? So when you think about antibiotics specifically treat bacteria, right? So they treat bacteria like streptococcus, like a strep throat. They treat bacteria like E. coli in a urinary tract infection. They treat bacteria like Klebsiella in a Klebsiella pneumonia. They treat bacteria. But when you're dealing with viruses, then we do have antivirals, but the antibiotics are going to be different. So if you go to your doctor, you're like, oh, I think I have COVID, give me some penicillin, give me some amoxicillin. They're going to be like, antibiotics don't work for viruses. But antivirals, we do have antivirals, okay, that can help with COVID, specifically the Paxlovid. Paxlovid is one of the FDA approved treatments for COVID. Now, not everyone is not indicated for everyone, but if you're someone who's at high risk, if you're over the age of 50, if you're living with obesity, if you have asthma, respiratory issues, consult with your doctor. In those cases, the antivirals, specifically Paxlovid, can be helpful. And then what was the second part of the question?
Oh, just steroids. So antibiotics, steroids, or etc.
Well, actually, and steroids can help for people who have severe respiratory distress with COVID. And if it's due to inflammation in the lungs, then they actually are given steroids many times. And so a lot of patients we were treating in the ICU during the original lockdown did get steroids when they were on the breathing machine, when they were intubated. So in some cases, the steroids actually can help for it. Yeah.
All right. Thank you for that question. Private,
Yes, thank
confidential.
you. Private. But you can share that information.
This question comes from J Dub or J
God,
Dub.
Dub. Hey, J Dub. Now, what you gonna ask? Hi.
My ankles have been swelling for months now, but I don't have high blood pressure.
Very interesting. All right. So, J Dub, you have swollen ankles. So, the first thing I'm going to say is I'm glad that you don't have high blood pressure, but I want you to be sure that you don't have high blood pressure. How are you going to be sure? So, beyond going to your doctor, I want you to check your blood pressure at home. Or if you don't have a blood pressure cuff at home, then you can go to a local pharmacy and check your blood pressure there. And you can talk to the pharmacist about how to do it. Or, definitely you always want to consult with your physician. And stay tuned because I'm going to put a link. There's a blood pressure cuff that I actually recommend and that I use myself at home. And I'll put a link in the description if you don't have a blood pressure cuff. But one thing you want to do is make sure that you know that you don't have blood pressure. And by doing that, you want to learn how to monitor your blood pressure at home correctly. Check out my video right here on this Dr. Frita YouTube channel on how to monitor your blood pressure at home correctly, where I go over all the proper ways. But for high blood pressure, if you have a systolic number of 130 or greater, or diastolic of 80 or greater, then that's considered hypertension. It used to not be. It changed in about 2017. So just being sure that you don't have high blood pressure. Okay, so now, good. Let's assume you don't have high blood pressure. Why are your ankles swelling? Well, there's different reasons. One, if you have a high salt diet, okay, when you're taking that salt, it can bring in fluid into your tissues. That can lead to swollen ankles. Also, if you're a person who's living with being overweight or living with obesity, then that can be a risk factor for having improper drainage of your tissues, and that can lead to swelling. You could also have something called lymphedema. And again, I'm not speaking these things on your life, J-Dub. I'm just kind of going through the possibilities in general, giving information in general for why people can get swollen ankles. I have a video here. Again, it's in that Wendy Williams series. If you go to my playlist right here on this Dr. Frita YouTube channel, go to the Wendy Williams section and scroll down to lymphedema. I talk about what lymphedema is, but that's something that can certainly cause swelling in the ankles. And then if people have heart disease, congestive heart failure can lead to a backup of fluid that can cause swelling in the ankles. Another thing that can do it is kidney disease, okay? If you have kidney disease and you're leaking too much protein, if you have proteinuria, especially if you have nephrotic syndrome, that can lead to swelling of the feet and ankles. The biggest take-home point, J-Dub, consult with your doctor. Again, what I give is information. It does not replace the history and physical and the information that your doctor has for you. And then certainly if you want to talk more in detail, go ahead and click the link in the description and join me for a telehealth concierge service. All right. So good luck to you.
Most definitely. Thank you. Chatting with Elise.
Hey, Chatting with Elise. Welcome back.
Elise. She has a question about hypernatremia and CKD stage 3A. What should one do on their part if possible if they have their hypernatremia and CKD stage 3?
Okay, hypernatremia and CKD 3A. That's a very specific question, Chatting with Elise. So to go into detail, then I definitely encourage you to join me on the telehealth concierge service. And I can go really get details on the labs because so hypernatremia means high sodium in the blood. But when dealing with the cause of hypernatremia, I don't look at just that one lab. I look at the other labs like potassium, EGFR, and there's many other things I would need to know in order to give proper guidance. There's even some hormone levels that I would need to know in order to give proper guidance. But yes, by definition, hypernatremia is high sodium. And then as far as CKD 3A, that's when you're dealing with a GFR, estimated glomerular filtration rate, between 45 and 60. Okay. And we know that there's 5 stages of kidney disease. 1 is the best. 5 is when one is eligible for dialysis or a transplant. And 3A is that better side of 3. There can be a relationship, but again, this is one of those detailed questions where I would need to know more information. And certainly chatting with Elise, you want to be sure that you consult with your physician and even more specifically, your kidney doctor. Anyone with CKD 3, 4, or 5, it is recommended that you consult with a nephrologist, a kidney specialist.
Good question. Here's a good question, Dr. Frita.
Oh boy.
This is from Sheree.
Hi,
Do
Sheree.
you have any resource for traveling or vacationing with CKD? It's difficult eating in restaurants.
Oh dear, that is such a good question. Because you're right, Sheree. It's one thing when you're at home, then you have a better control. You can buy fresh fruits, you can buy fresh vegetables, you can buy your meats that you season yourself, your beans that you season yourself, make your juices, make your smoothies. But when you go out to a restaurant, you really don't have control, do you, on how much salt? And there are things that you can do, like you can ask the chef not to cook with salt, or you can ask them not to add salt. But even still, you're not necessarily in total control because many foods are already marinated. So the best advice that I can give is, number one, if you haven't done so already, I would consult with a dietitian to help to give you strategies on what is specifically safe for you as far as eating in restaurants. I would avoid fast food restaurants because fast food restaurants tend to have a lot of preservatives. And depending on the level of CKD, the preservatives can be high in phosphorus, high in salt, which is not great for you. So avoiding eating in fast food restaurants. And then when you go to a restaurant, of course, avoid eating certain things like excess red meat, or certainly avoiding eating pork, avoid eating salty foods, avoid, even if you go to, like, say, a sushi restaurant, sushi can be great, but you want to avoid having a lot of that soy sauce, which is loaded with salt, loaded with sodium. And you want to try to have some fresh things in the restaurant. If you eat meat, ask for fatty fish like the salmon. If you get the blackened salmon, it's likely going to have a lot of salt. It's likely going to have a lot of salt. So you want to go ahead and make the request. Please don't add salt, and you can add what you want to taste at the table, but perhaps they can do more garlic, herbs, things of that nature. If they're giving you vegetables that are already like pre-sauteed, you might want to avoid those. I recommend that you avoid those and get steamed ones. But you're right. Eating at restaurants is a challenge when you have CKD because there's salt and there's preservatives. But I would just go ahead and be bold and be an advocate and ask specifically for the server to request that you have low salt foods, and then you go ahead and do the rest, avoiding the foods that you know to avoid. Good luck to you.
Very much so. 2 more questions off the fishing, and I'll
All right.
leave you at that. This is from Wanda.
Hi, Wanda.
Is taking turmeric daily bad for you if you have thyroid disease and GERD?
Ooh, that's a good question. Now, for this one, I'm going to have you to consult with your physician because, again, there's going to be a whole lot of factors. How bad is your GERD or your gastroesophageal reflux disease? What kind of thyroid disease do you have? Is it Graves' disease? Do you have thyrotoxicosis? Do you have Hashimoto's? Have you had thyroid cancer? All of these things can depend, but just in general information, turmeric is one of those anti-inflammatories, and it tends to be helpful with joint pain in some people. It can be helpful just getting inflammation down in your body in general. The trick about turmeric is that we don't necessarily have a whole lot of randomized, huge, controlled trials to give us very definitive data. Why? Because I don't know of any pharmacy companies that will pay for a multi-million-dollar study when folks can go around the corner and get turmeric for not very much money. That's just kind of what it is. We know that medicine, in a lot of ways, is a business. So very specifically for this question, I would consult with your physician about the turmeric. But in general, turmeric is a wonderful anti-inflammatory, one that I use and one that I have family members who use as well.
Thank you. And lastly, we'll go to Miss Mestina.
Hello, Miss Mestina.
Hello, doctor. I'm currently on Mounjaro and have recently lost 30 pounds. I was told this medicine would help my CKD, but my GFR went down to 43. Not sure if I should continue or not. I have FSGS, nephrotic syndrome.
Okay. All right. That's a good question, and that's a loaded question. So I'll just hit on a few of the key points, and definitely, you want to, for sure, consult with your physician, your nephrologist specifically, or if you want to run this by me, where I can give you an in-depth second opinion, then I recommend the concierge service. But I'll just hit on kind of a definition of some of the things that you brought up in your question. One is the Mounjaro. We know that's one of those GLP-1 agonists. Also, it's like a combination, but it's the tirzepatide. And the weight loss version of that one is Zepbound. And yes, you've lost those 30 pounds, congratulations, because losing that weight it can be good in a lot of ways, because it can improve your improve your insulin resistance. So if you had diabetes or pre-diabetes, it can certainly help with that. It can help with joint pain. It can help in some studies show it can help to improve heart health. Now, you mentioned the kidney health. So yes, we have had a flow trial, where one of these weight loss medications, a GLP-1 agonist, was in a study to see if it could help with CKD, or chronic kidney disease. And the study was actually stopped a year early because there was overwhelming evidence that it could help with CKD, okay, in general. But you brought up a few things. One, you have FSG, or focal segmental glomerulosclerosis. We don't know, and only after your physician goes through it with you in detail, we don't know if the decline in your GFR is due to the Mounjaro, or is it due to inflammation from FSG? Okay, because two things can be going on at once. In other words, it's not necessarily the Mounjaro that has caused it, but there are ways for your nephrologist to figure out what the cause is. Okay, so consult with your nephrologist. The other thing, as I mentioned before, these weight loss shots like the Mounjaro, while they're helping you to decrease your appetite, that's helping you to lose a lot of the excess adipose tissue or excess body fat. Well, the question for you to ask yourself, is this Mounjaro causing you to be less thirsty? Because if it is, and if you've been dehydrated, then your decline in your kidney function could be due to pre-renal azotemia, meaning dehydration could be contributing to it as well. Also, you want to look at other factors, and it's a lot of details to get into it, but I guarantee you that a good kidney doctor, a good nephrologist, can really help you to sort it out, to decide the risks and the benefits of the Mounjaro. Yeah, great question.
Great question. All right, Dr. Fisher, I'm gonna give you your flowers. And I think these two users or subscribers, their names are very fitting. This is for Florent.
Florent. Oh,
yes.
Is that French?
Hello, doctor. I really like your video. I learned a lot from your videos and have also downloaded your Healthy Habits PDF.
Oh, wonderful. Thank you. I appreciate that.
And then Lavender. Hi, Lavender.
Hi, Lavender. Ooh.
Very impressive. I admire you and your achievements.
Oh, I appreciate that, Lavender. I appreciate you very much. And I appreciate everyone who's here, who's watching this live, who's in the chat, and everyone who's watching the replay. Again, Shador and I work very hard to make sure that we give you good evidence-based information. We're here on Mondays answering these questions live because we really want everyone just to live their healthiest, happiest lives. So if you have enjoyed this, as Lavender and Florent have enjoyed it, y'all know I'm messing up those names, but I like it. Then please make sure that you like and that you share this video, subscribe to my channel, and hit the notification bell so you'll be among the first to know when I release new content. And I am going to be releasing some content. I had fun in a YouTube video that I just recorded where I take y'all on a grocery shopping trip with me, and I share 10 summer fruits that can help you to lower your blood pressure without medicine. Yes, y'all, I'm all up in these people's grocery store shopping, but I'm going to release that. And then just this past week, I was on a national news show, News Nation, talking about DIY home test, okay? Do-it-yourself medical test. So I'll be releasing that. But if you hit the notification bell, you'll know when I release that content. All right. So this ends our Medical Monday. We'll see you next Monday, 6 p.m. Eastern Standard Time, same bat time, same bat place. So we'll give you more of the hot health topics in the headlines. I thank y'all for watching.